Hello everybody, meet Demi. Demi is here at Countryside today for an ovarian hysterectomy or Spay procedure. She would like to show you a day in the life of a surgery patient at Countryside. The first thing we do is grab an updated weight on your pet. We base all of our anesthetic drugs off of weight. After getting off of the scale, patients are taken to the treatment area to get their pre-surgical exam done. The doctor will then listen to their heart and lungs, assess their gum color and hydration, and take an updated temperature. Your pet is given an anti-nausea medication to assist with any GI upset that might come from anesthetic drugs. All surgery and admitted patients receive a blue paper collar, or we call a day pass. This collar contains their name, their client number, and the reason that they are in the clinic. Personal belongings, such as collars, leashes, and harnesses, are placed in a basket with the patient's name on it to ensure that it doesn't get lost throughout the day. We use the updated weight that we got to calculate the anesthetic drugs that will be necessary and confirm those doses with the doctor. One technician will start recording medical records and charges for the patient, while the other technician draws up the drugs and labels them in syringes. All medication must be double-checked by a pharmacy technician prior to being administered to a patient. We start out with a pre-medication that consists of a sedative and a pain medication. The combination of these will help the patient become more relaxed before we place an IV catheter. When the patient is relaxed enough, they are transferred from their kennel to our treatment area to begin surgical preparation. To start placing an IV catheter, we shave a small spot on the front leg of the animal. We then scrub it with surgical scrub and alcohol before placing the IV catheter. When IV access is confirmed, the catheter is then taped in place. When the catheter is secure, we connect them directly to fluids. When the patient is starting to receive fluids, we administer our induction medication. A tube is placed down the animal's trachea and secured into place. Patients are then connected to our anesthetic machine, which allows them to inhale oxygen and the anesthetic gas that they will need for the entire procedure. When the patient is connected to our anesthetic machine, the balloon on the endotracheal tube is inflated, and oxygen and the anesthetic gas are turned on. Giving the patient a few manual breaths will confirm whether the endotracheal tube is placed properly. All surgery patients receive a complimentary nail trim. Surgical prep is started by shaving the area where the incision will be made. The area is scrubbed with surgical scrub, followed by alcohol. We repeat this process 3 times. When the scrub is finished, we're able to move the patient from the treatment area into the surgical suite. Once in the surgery suite, your pet is placed onto a warming table while another technician collects the leads to the vital monitoring machine. One final scrub is completed in the surgical suite, starting with the surgical scrub followed by alcohol, while the doctor scrubs in for the surgery herself. Once sterile, the doctor will go in and put a surgical gown and gloves on to prepare for the procedure. The technician will open the surgery pack and any other materials that the doctor may need prior to starting the procedure. The doctor will create a sterile field around the patient and give us a heads up when they are ready to start the procedure. The technician will continue monitoring your pet and communicate with the doctor of any abnormalities that may occur. A photobiomodulation laser is used post-op to help healing. Once complete, the balloon of the endotracheal tube can be deflated. We can disconnect them from their IV fluids and keep them comfortable while they prepare for their recovery. Technicians will monitor the patient closely to ensure proper recovery. When the patient decides to swallow, that's time for the endotracheal tube to come out. Once your pet is extubated and more alert, they're moved to a recovery kennel for further observations. As long as the recovery was uneventful and the patient doesn't appear to be in any discomfort, we're able to remove the IV catheter a couple of hours after the procedure. It's very common for us to get the "I need to go potty" look early afternoon. We do take your pets out potty once they are more alert. However, we do wait until they're able to fully walk outside on their own to do so. Demi's procedure did require her to have post-op incision protection. We can supply either a medical pet shirt, which is essentially a onesie, or an Elizabethan collar, aka the cone of shame. It's important to know that the cone must extend about 2 inches past the dog's nose in order to be long enough. Thank you to Demi for demonstrating a typical day in the life of a surgery patient here at Countryside Veterinary Services.